Our next session is from Mystery to Mastery, applying AI in healthcare. Like our first session, this is also a one-to-one conversation with Todd Crosland, the industry principal for health tech at Snowflake, and is moderated by Carly Rowe, the senior VP of product for Inovalent. And now I'm going to go ahead and turn this over to Carly.
Hello, everyone out there. Thank you so much for joining us today. My name is Carly Rowe, and I am the Senior Vice President of Product here at Inovalent, where we're focused really on empowering thousands of customers across the care continuum to improve healthcare outcomes, performance, and efficiency. I'm really excited to kick off our fireside chat discussion today with a focus on going from mystery to mastery and applying AI in healthcare. I'm joined today by Todd. So Todd, would love if you could introduce yourself and share a little bit more about yourself.
Yep. Thanks, Carly, and thanks for the group for having us today. That was a great discussion by Chris and Shahid, just right on that. I think we'll roll well right off of that. Yeah, global industry principal, healthcare and life sciences here at Snowflake. Been in the industry over 35 years, former CIO in the health tech space, very early adopter of the Snowflake platform back in 2016, and I've now been at Snowflake just over 6 years. So thanks for having me.
Yeah. So to continue the conversation, as you said, we're talking a lot about the impact of AI in healthcare. And I'm sure for a lot of people out there, it seems like AI is in every corner of every article and every topic of healthcare. And if we think back several years ago, there was a major transformation in healthcare to start really moving to, electronic records and going digital. And when that first came out, it was, excitement and optimism, but also a bit of skepticism. How's it going to work? Where's the information going to get stored? And it feels a lot like there's a similar trend happening right now with this conversation around artificial intelligence. And so, I think there's a lot of excitement, but there's also an equal amount of skepticism and I'd say an overall hunger for more knowledge. So maybe we should start and take a step back and talk about what is AI and, what are some of your thoughts and the benefits that you see coming from this?
Yeah, I think the approach that I've taken in my past, and I think that if it reflects what cloud providers and hyperscalers, but also Snowflake is taking, is an approach to meet the user and meet the persona where they are when it comes to AI and ML. And to your point, it can be overwhelming. And I think the beauty of where we are now versus where we were, and I have so much love for the data scientist community. So from a persona perspective, right, much love for you guys. And none of this exists without, right, the foundational models that Chris and Shahid talked about. But we needed to remove the mystery, right, of out of this and really make it approachable to everyone. And so I think that's what we've done, and what needed to happen was an ability to walk into a platform like Snowflake and say, I'm a subject matter expert. And let's say I am in pharmacogenomics and my background's in pharmacy, but I'm not a SQL expert. I'm not a Python expert. I just want to ask questions of data and get answers. And so I think we're there now, right? So the copilots and what have you, and Snowflake's copilot is one of those. That for myself, I'm not an expert at SQL. I can dabble in Python, but I have background with subject matter expertise. So now, right, to remove the mystery, you have an ability for a data geek subject matter expert persona to engage, right? And what's happened is the data scientists and the people building the models have created that capability. Now we're giving people like us access to that, which we didn't have before. So I think that is the big, right, the big change and the big elevation that we have now for AI and ML that is much more accessible. And then to take it a little bit farther, even as a data engineer, and I did this with a team, shout out to Myriad Genetics, I walked through with them a SQL statement where I did sentiment analysis around genetic variant details and some phenomenal variant expression data that had been collected by one of our other customers. And I ran sentiment analysis with one line of code. And that's a beautiful thing, right? Like as a data engineer, I may not be good at writing models to do sentiment analysis, but I know enough, right, that I have enough subject matter expertise, right, and I have enough engineering expertise where I can now jump in there and do that. Right. So I think that's where we are today. If I were to kind of encapsulate it, is that personas are now being engaged that we're not able to do it. It's like, oh, I got to pass it over to the data scientist to go do this. Well, now I can actually go do that myself. So to me, it's an insanely exciting time.
I agree. And it sort of takes the, I'll call it the fear out of it, right? That you don't need that data scientist degree to really sit down and think about, we all have ideas. And I think at the core, the ideas are around how do we improve the patient and the experience for the patient in their care journey, right?
Right.
And so I think when you take that AI and you take the expertise, right? The expertise surrounding the healthcare and the act of what you're trying to improve, and you think about that application, to your point, I think that it makes it more accessible right. for everyone. And I think it's interesting. So we spent some time surveying some healthcare professionals, around 400, kind of spanning the care continuum, kind of asked them what their sentiment was when they thought about AI. How did they feel about it? And we kind of honed in on revenue cycle. And right. About a quarter of them said, I'm pretty skeptical, and I'm maybe not quite sure about where it applies or how it could apply within our business. And so I think that's a really great way to think about, it doesn't have to be some crazy new area that your organization hasn't dove into before. I know in our organization, we've spent a lot of time looking at very traditional processes within revenue cycle. Take right. Something like eligibility, right? It's been around for a long time. It's not net new, but maybe the approach and how we could be using AI to think about a traditional process, but applying technology to do so in a more efficient and a more intelligent manner. That's where it gets exciting, right? And I think the coupling of it's accessible to all, but it also can apply in terms of use cases to very traditional parts of a healthcare organization's process and workflow. And I think there's a lot of opportunity. So if I ask you and I say, hey, a lot of our customers that look at that revenue cycle management, there's a lot of manual components. There's a lot of human touch. There's a lot of things that, is redundant. And especially as staffing challenges continue to be a struggle across healthcare, there's a ton of opportunity to take some of those tasks and take some of the pressure off of healthcare systems from, approaching those manual steps. And so would love to hear your thoughts on some of the opportunities that you see in terms of that automation.
Yeah, and again, going back to those personas, I spent a lot of time in the specialty pharmacy arena, and this, definitely equates to high dollar spends, whether that's specialty pharmacy or surgery or what have you. And anomaly detection is massive, right? There are people I've worked with throughout my career that are phenomenal at understanding revenue cycle, but they can only look at so much data in a certain amount of time. And going back to the enablement, when you see a platform like ours, it says, hey, you've got some data and you want to run anomaly detection. Oh, wait, you don't know how to build a model for that? That's okay, right? Like it's saying, look, I've got this model here for anomaly detection. You're the expert at saying, these are the columns of data I want to look at. Now, please, every day, right, when new data comes in, I want you to look at anomaly detection. And for me in specialty pharmacy, there can be mistakes in coding. There can be, right, many reasons why. And when you're talking about that, that is not an insignificant amount of money, right? Just by pure mistakes and pure, errors. So I think that's to take my example back again, it's saying, I'm now enabling you as a persona to be able to do things that were just, right, not even approachable, 1 year ago, 2 years ago, to now saying I can do that. So that's where we're seeing in revenue cycle management, just from an automation perspective and a volume perspective, to have coverage over an amount of data that we just did not have before. And then I can get into then you go the other route, from so that's kind of traditional ML, right? And that's been around, but just not as approachable.
Yeah.
Then you fast forward to from a Gen AI approach, and we had fun talking about this to prep for this call, is my infamous battle of the bots. And you look at the appeals process where you have all this tons of documentation that's generated, and how do we work through the appeals process? And I fortunately or unfortunately had a conversation in the span of a couple of weeks with a revenue cycle management organization representing the provider and a payer organization. And let's just say that they're both using Gen AI to almost approach the appeals process from both sides. And what happens when those two meet in the middle is, in essence, battle of the bots, right? So you're utilizing Gen AI to absorb an appeal, right? You're using Gen AI to produce an appeal. It's like, wait a minute, maybe there might, looking into the future, maybe there might be a better way for that. But it's revenue cycle management. Some people are like, well, that's not very exciting. Oh, I'd say it's pretty exciting right now, right? I mean, there's a lot going on there and a lot of potential, and we see it across our customer base that's in that area.
I agree entirely, right? And I go back to, again, the staffing challenges remain ever present. And so how do you still deliver the same level of a care experience for a patient with a limited amount of resources, right? And I think that there's a real opportunity to think about the positive experience that AI can enable in thinking about how can you streamline some of those more kind of mundane or manual processes, not to eliminate your staff, to really make them more efficient in the tools that they have, right? And you think about behavioral health, and you think about the admissions department, and you think about what would typically happen in terms of a patient having kind of an episode. And when you think about that, maybe they have a family member who has an insurance card. Maybe they've got, a staff member. Now the staff behind is trying to enter that information or piece together, and a patient's maybe not thinking about, did I bring my insurance card? Do I have this information? Or they're not thinking about, well, how is this going to impact, whether or not this is going to get paid, or am I going to have to pay out of pocket? And so I think you really think about, that experience and say, well, okay, there's no intervention that's happening today in sort of using any AI technology to think about that process. And so you've got a very manual, am I dialing, the insurance company up on the phone and asking for clarification? Am I, photocopying something or scribbling something on a sheet of paper and then re-entering that in 3 places? And so imagine if we thought about that process and, it's already there. The information's already been pulled up, and it's just, hey, can you confirm this? Great. And from a patient who might be coming in and having that episode, the last thing on their mind is thinking about, well, what are all the documents that I need to make sure that I can get the care that I need when I need it? And just thinking about that really starts to, I think, open up the concept of what are all the different ways where you could think about modeling and bringing in that efficiency such that the information is present, the technology is leveraging all of the data and all of the tools out there to make the care experience so much more positive, right?
Yeah. And where I see that, I'm going to go underneath the modeling aspect to it, to the collaborative aspect to it, right? It's that what we're seeing is when you look at value-based care, right, versus fee-for-service, and you have with value-based care, not just the desire to collaborate more, but it's a must, right? There's no way you can do value-based care without having a collaboration agreement between multiple entities. We'll get all the details there, but I think we all on here probably understand that. But it's what we're seeing is, to your point, is the simplification of process. And so you have agreements in place whereby there used to be oh my gosh, this was always a prior authorization situation. Now with collaboration, right, patient presents, and because there's a payer provider agreement to collaborate on the data, that patient is just whisked in. I'm exaggerating maybe a little bit, right? But hopefully the patient is whisked into the situation and being able to have the great care. And there's a lot more data for them that they have access to, because there's some type of live data sharing collaborative agreement which in the case of Snowflake, you're allowed to do that without copying data, right? What we want is up-to-date data, not copying the data, providing access to that. Now, if you have that base, right, if you have that collaborative underlying capability, right, eligibility, check, right, to your point, like we're not having to scramble around and figure it all out, then you can take that up a level and say, okay, what type of models can I run on top of that? How can I now summarize my exchange, right, with the patient in a behavioral health sense? I mean, there's just a little bit of unstructured data in behavioral health, right? I mean, we have plenty everywhere else, but behavioral health, I think, takes the cake for that. But now I can talk about, I can up level my care, and let's take care of, let's make the administrative process very important, but much more efficient. And now let's really focus on the clinical side, and let's look at summarizing things and taking a lot of unstructured data and then building models around that. So I think that's the whole key there, is that shift. And let's take care of those things that are administrative and repetitive and error prone, by the way, right? So
and I think, at the end of it, when you think about the ability to take some of that unstructured data and, I think about, again, the whole continuum, what happens kind of upfront from the time that patient's getting care, the claim denials, right? Denials are a #1 topic for a lot of our providers, and how that's impacting reimbursement, and thinking about, again, the models. How do you take some of that clinical data? How do you make sure that when you're submitting that claim, it's got all the information and that you're not missing anything from upfront? How you model out and predict, hey, I know if I'm missing this information, it's going to get denied. We know that. We know exactly what's driving those denials. And so starting to think back and say, modeling out, capturing that information, preventing it before it's ever going out the door, and before it's going to hit the denial, before our providers are going to get caught in the reimbursement wheel and hit the delays and start to question, okay, well, how do I need to manage the cash flow now? There's so many of those scenarios when you think about the opportunity to, I think, become more efficient with how we're approaching that structured and unstructured data, and feed it into models that over time continue to kind of evolve and learn from themselves. And I think that's another interesting aspect of, the concept around ML is continuous learning, right? It's a continuous learning, so that as the healthcare scenarios evolve and new scenarios invent themselves, those models are continually learning and evolving. And I think that's also the power of not saying this is a static thing that fits at a point in time today, but that may not fit your needs or your patient, or the way that the healthcare data is structured, a month or a year from now. It's kind of continuously evolving to the needs. And that, to me, is also, I think, a huge advantage of thinking about applications of AI within healthcare.
Yeah, I think what I've seen, it's amazing, the rise of streaming, right, data access, and how important that has become into our platform, into many other platforms. Is, to your point, that little bit of information, that new nugget of information can really affect a model, can affect decisions, right? And we have come a long way, right? When you think about batch files and CSV files, and I joke to people, I won't say my age, but if you look it up, FTP and me are the same age, right? And I'm like, it's time, right, that we don't depend on the incessant copying of batch files that are over a month old. There's a desire for, right, more speed to insight, right, that it was not fathomable, right, even a couple of years ago. But now, because of the fact that we are able to stream data into places and build those models on top of that, you can do that, right? And there's no excuse not to. And the shameless plug for the likes of an Inovalon is that's why you guys are here, because you guys are the experts at doing these types of things, right? And building products that are going to enable your folks to do those. So
So I know we're coming close towards the end of our time, and this is a question I'm excited to ask you. But When you think about advice that you could offer for those who might be at differing stages of their journey in AI, what advice would you have to offer?
Yeah, I get asked this a few times, but I try to paint a picture for everybody and kind of use an analogy. Whenever, if you're an IKEA fan, there's a little plug there. If you've ever bought a piece of furniture, right, and you open up the first page, what does it tell you? And the answer generally is, if it has any bolts or screws or whatever, don't tighten them all. And I think that's the vision to put inside your head as a leader, as a practitioner, in any aspect of everything that's happening right now. So much is changing so quickly. Is that if you're entering this, let's say you have your data foundation. Let's say you have good quality data, right? You've got good retrospective analytics. You've got good near real-time analytics, and now you're ready to take the dive and really dive into this. The key is that wherever you start is not where you are going to end. The furniture that you think it looks like one way, right? It turns out because if you do bolt it down all the way, your headboard's on backwards, right? And something's going to look really insane, and you're going to have to go back and redo a lot of work. And so I think the key here is to say that when you try to use, in Snowflake, a Cortex function for a sentiment analysis the first time, right? Think of it as an experiment, right? Go in, get just enough data to perform just enough of a sentiment analysis to then look at it and then assess it and be like, is this good? Right? And use your subject matter expertise, use your background, right, to assess it and say, is this, and then secondly, is it valuable? Number one, is it accurate? Number two, is it valuable? Right? And then build on top of that. Now, I'm not saying that you don't, if your furniture has 3 pieces or whatever, you might take one of the pieces and go all the way, right? And you're like, oh, I know exactly what this is, right? I'm going to create as one of our customers has done, they have all this massive amount of documentation, right? And they created this beautiful chat bot on the front of it. It was a clear-cut case. They went in, did I'll get a little technical, some retrieval augmented generated, work from an LLM perspective. And now their users have this beautiful access to ask any question of all this mounds of documentation. Go do that, right? High value, simple, right? In certain terms, right? And very low risk. Go for it. But for things that you're uncertain about, experiment, right? And cloud platforms, like ours and others allows you to iterate through that. So just don't go through and just have this impression of, I'm going to do exactly that. You're going to start there, but you're going to end somewhere else, right? So go into it with a very iterative approach.
I love that analogy with the bolts, and I'll take it a step further. It makes me think back to, the first time, you might be becoming a parent and you buy a crib, right? And I think it's relevant in terms of the analogy and thinking about AI, and you've got to know to get in the room where you want the crib to be. You've got to know the space in which you're trying to improve, and you've got to have I'd say a construct or an idea of where that application fits, right? When you think about AI. And it's the same with the crib, right? You don't want to put the whole crib together and put it together outside the room and then go, oh, how am I going to get it through the door, right? And so I think it's a similar kind of concept where, to your point, you don't want to discourage the experimentation and the thinking of the unknown, or go in with this crib has to go in this corner, in this space, in this dimension. But you do have to know, hey, this is a place around where I know we could have improvement, and you're understanding, what are the different inputs, what are the different outputs, and how do I want to start to think about modeling, right? How do I want to think about the overall process? And so I love that analogy, and it still rings true every time I think about the first time we did not, for the record, build it outside of the room. We definitely built it inside the room. But I would also say, just to double down on your point earlier, right? That model will continue to evolve, continue to grow. And so, don't let perfection be the enemy of progress. Getting started and starting that process to think about opportunities for machine learning and AI within the healthcare context is an exciting time, and it's an empowering time to think about those opportunities. And so It doesn't have to be perfect at the first go out,
Right.
but leaning in to understand where are those improvements needed, what needs to be tweaked, what needs to be tightened, what needs to be loosened, what needs to be shifted to the right. And so I think it's about embracing those opportunities and embracing the mindset of there's so much potential and so much opportunity within the healthcare. So I'd encourage everybody out there, and there's a lot of great discussion, and even just prior to us, on really learning about what is AI, what are the use cases that are out there that have been successful, right? And how do you take something that seems very mysterious and ambiguous and turn it into something that, to your point, becomes very accessible no matter who you are and no matter the depth of data and expertise and technology that you have. So very much appreciate everybody's time. And I know we covered a lot in a short period of time, but very much appreciate everybody tuning in. Todd, as always, thank you for sharing your expertise and your experiences. And we hope that everyone found this discussion exciting, and maybe you jotted down a couple of new ideas and how you can think about applying AI within your world today.
Carly and Todd, that was a great
you.
30 minutes. Thank you so much. So appreciate it. So session 2 is done, and we are going to be going on to session